The purpose of a brachioplasty or arm lift is to tighten, and basically what a brachioplasty does is it tightens up the skin around the arms so that you have a tighter contour and improved contour of your arms. Most people who need a brachioplasty have lost a significant amount of weight, meaning that their skin was once stretched out by excessive amounts of fat in that area, and then they lost weight and now the skin is loose. And unfortunately, the only reliable and effective way to tighten up the skin around the arms is to perform a brachioplasty, where we remove some of the extra skin, putting the scar along the inside of your arm. So the goal when we do the operation is to try to hide the scar as best we can so that when your arms are down against your side, you can't see it. However, it is not a great location for a scar. There is no great way to hide it. There's no shortcut to this operation. I wish there was, but you are going to have a scar on your arm forever. So I always tell patients who are interested in a brachioplasty, you have to be willing to trade loose arm skin for a scar on the inside of your arm. It's usually right about here. We can kind of move it a little bit back or a little bit more to the middle, depending on where you want it. But bottom line is you're gonna have a scar there because that's the only way to get rid of all that extra skin and tighten up the skin around your arms. At the same time as we do that, I always perform a bunch of liposuction. So we'll do a bunch of liposuction to get rid of the extra subcutaneous fat around your entire arm. If that was all we did, the skin would be really loose and you would look even worse. So when you have loose skin to start off with and we suck out more fat, we're gonna have to get rid of that extra skin somehow. And the only way to do that on the arms is a brachioplasty, which requires that scar to get rid of all that skin and tighten up your arms. The way I like to do a brachioplasty is I start off by marking you before surgery, and together we plan out where your final scar will land on your arm. Once you're asleep, I perform a bunch of liposuction around your entire arm to get your arm debulked and sculpted and thin as I safely can, that will still fit your body. And then after that, we pinch out all that extra skin along the future scar line that we selected. And that is how a brachioplasty is done. I do not put drains in brachioplasties. It is unnecessary given the technique that I use to do it. But the biggest thing to remember with a brachioplasty, and I cannot stress this enough, is that you are trading loose skin for a scar along the inside of your arm. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.